loans, and then the default rate won't be as high as it might otherwise be. So it seems like it could be like this thing that could be perverted. You know, they could use it they could advocate for it for a reason other than the intended reason. Because if you have it where students aren't taking out loans, but they're going to public benefits, but the question is well, what's happening after graduation? Are they getting jobs so that they have gainful employment? And there might not be as good an indicator, right, if they're not taking out loans and we don't see the ability to repay if they go to public benefits route. So if you could address that.
So from a data perspective, we are measuring whether or not the students had benefits before they came to us, whether or not we were helping the student with benefits, and how they complete. I will still say we're kind of early in the program because our student progression and completion, because most of our students are part-time, we don't have the graduation rate yet. But we do have some persistent rates where we know that between 5 and 7% higher for students that we've helped with public benefits than those who either didn't have benefits or had them before they got there. So we are helping students at a higher rate. The question about loans is a tricky one. If I understand your question correctly in terms of the benefits to the colleges and as it relates to the default rate, and related to whether or not benefits offsets the student loans, I think that's a little bit tricky to know. If more students are really saying that they don't want to borrow student loans and they're getting benefits, because sometimes they're actually getting both. Just because they're eligible for both, they actually get both. But I don't think that there's an intention that, I think beyond the public benefits, globally more institutions are thinking debt reduction is key to student success. But part of that debt reduction is accelerating time to degree. So schools are focusing on how fast students finish, so they're taking out less loans because they're finishing faster, you know, time to degree. But I don't necessarily think, it's certainly a benefit to the colleges that the cohort default rates are declining. But I don't know if you could really make that parallel between the intention is that the schools benefit by decreasing their default rate by relying on public benefits to kind of offset student borrowing. I don't know if that's a correlation that's known or definitely not intended. I think everybody's concerned about student debt reduction and everybody's concerned about default rates, but for lots of policy reasons, schools have to be really conscious about their cohort default rates.
Yeah, we did have an evaluation. Our project was very short. The ACC was 27 months, I think, and that may be stretching it. And so we weren't able to look at completion data. The data around persistence showed higher rates of credit completion. But again, I just say that was under a very short period of time. Gateway also did an ROI study that showed that it was worth enough to them that they were retaining enough students over their previous organization that they kept those 2 positions and funded those. And so I think that speaks pretty loudly if an institution is willing to go ahead and keep in place 2 new positions to help folks. One of the recommendations in this paper is that we have an experimental sites, a demonstration project of looking at what are the impact of public benefits on college students.
I guess the only thing I'd add on your second question is, I think it's certainly there's a legitimate tension there, and institutions have lots of reasons to try and get their default rates down. We see plenty of community colleges not letting their students borrow at all to avoid having high default rates. So you know, we see institutions do this. I'd like to think this is an alignment where what they're trying to do for students helps them as well. But it's definitely a legit thing to be aware of, to be watching. Yeah. Go ahead.
I would just say, in response to that question, I'm with the Institute for Women's Policy Research, and we did a little bit of data analysis trying to use the survey of incoming program participation to look at, and other sources to look at that question about completion and whether it's approved by public benefits access. And I think the tricky thing is that people who are receiving public benefits are among the very lowest income part of the student population, and it's difficult to find exact correct comparison group. So I don't think, personally, I don't think you're likely to see huge increases in completion and retention because of it, but you may see some reductions in the kind of hardship that that Sarah Goldberg found in her report this week, and I think that that's a significant goal in itself, and I would imagine we'd expect some modest improvements in completion, but by no means would we imagine that this is going to be some gold windfall for the colleges, because so many of these benefits are very small and difficult to get. I think it's just a benefit for students primarily.
Right, but there's just one thing, it's just the, I think there's a study that came out that said the ones that default the most are not the ones taking out the most, but the ones taking out small loans.
Yeah.
But
So-
that's mostly because I mean, that was that ACCT study that was really stunning. They also aren't completing any, I mean, the biggest problem for them is they're barely completing, most of them have completed barely any credits. I mean, so you're right, it's not about the dollar amounts that can get students to default, but it's whether it seems to be whether they stay in school and make progress, so, yeah. In the back.
I was wondering if a lot of community colleges are now offering child development centers to their employees, and if there's been any look at merging that with allowing for child care subsidies to be used at those centers, and also accessing federal food funding through the Child and Adult Care Food Program, so students can actually bring their kids to campus and get the benefits of quality, affordable child care.
I don't know the answer to that question, but maybe Barbara does.
Yeah, I think there are campuses that are doing that, but sadly the trend is moving in the other direction, where we're seeing those campuses with child care centers closing them at a steadily increasing rate, because it usually does involve some investment of general funds on the part of the college, and they're looking for places to cut. So I think that's one of the places where, you know, maybe we can look at integrated funding streams or some innovative solutions to try to keep that from happening and actually expanding access to childcare.
I know that's a challenge. We were an institution that had a child care center about 10 years ago, and we closed them. Before we started this work, we closed the child care centers, but it was cost. It was, and what we found too is that most of the clients were not our students. We found that most of them were folks from various parts of the community who would come in and use the services. And so we looked at that analysis too to see if it's benefiting our students in terms of the cost that there was a lot of cost in the general fund to maintain that.
And just a quick question about the number of students who this are, I didn't see, I haven't read the whole paper, but do we have like a baseline of how many students nationally we're talking about in this report?
No. I mean, do you mean like how many might be potentially eligible for public benefits?
Yeah, I mean, or the baseline of students going to community colleges, or?
Yeah, I mean, I actually had something of the same thought. Is sort of how big is this pool of students that we're talking about, and it's probably, you know, I don't know what the equation would be that would get you there, but I mean, you know, I was just looking at the data on the number of, we obviously know the number of the percentage of free and reduced lunch. I mean, there have been some data on the number of students who have food insecurity. I don't know whether the survey, the Hope Lab kind of survey stuff is, you know, that's obviously an important one indicator, but I don't know what. Yeah,
Kentucky, so this was interesting. It would be really great if states could match data. And it would be really great if the feds could match data, and Mark here could talk to his friends at FNS and at HHS and find out what's the overlap between Pell recipients and those receiving Medicaid or those receiving SNAP, and what's the gap here. Kentucky was able to do that as part of this initiative, and I'm not going to quote the numbers correctly because I don't have that report in front of me, but it's in the Benefits Access for College Completion evaluation report put out by Equal Measure, that they did a match between students who were on their campus and their income levels and students who were receiving public benefits, and found a gap of roughly 2,000 students on campus who they thought were likely eligible for public benefits. And that's a small institution. I think they only have 7,000 or 8,000 students at that institution. So, but that's only one institution. But this is the kind of work that we think states should be engaging in to get a better sense. And that's simple data sharing that you could do, and then you could reach out to those students. And that's how some institutions have gone
Angela,
forward.
did your gap analysis provide any sense of that?
Right, so the 80% of the students who, of the 20,000 students who received Pell, 80% of the students received the maximum Pell. And we believe that those students would have all been eligible. They had a 0 estimated family contribution, so they would have been eligible. But there was a big percentage of those who were already receiving Pell. What we were trying to do at our institution, we're still trying to work on the MOU, is that our state would allow institutions to submit, but it'd be